Hello, everyone, and welcome to Heartfelt Happiness, presented by Inspira Health's Spirit of Women program in partnership with Cardiac Partners. Thank you for joining us. My name is Matt Brown, and I'm the Assistant Vice President of our Cardiovascular Service Line and also your moderator for today's program. Before we get started, I have a few housekeeping items that I'd like to cover. Please note, the information shared is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Secondly, we as panelists are unable to see or hear you in our Zoom platform. Attendees will remain muted and off camera throughout the duration of our program. Now, please refer to the Q&A tab located at the bottom of your screen. Here you will submit your questions as they will be answered at the conclusion of our program. Your question will be visible to the panelists, so if you would like to remain anonymous, please check the box ensuring so. Also listed at the bottom of your screen is a hand icon. Please use this function if we ask you to participate in today's discussion, and you may lower it by clicking on the icon again. Poll questions will appear on your screen during the presentation. We encourage your participation as we engage in a lively atmosphere. Lastly, a recording of today's presentation will be provided to you in a follow-up email this week. I'd now like to introduce our speaker for today, Dr. Kurt Kaulback. Dr. Kaulback is an interventional cardiologist at Inspira Medical Center, Mullica Hill, and a member of Cardiac Partners. Dr. Kaulback completed his medical degree, residency in internal medicine, and fellowship in cardiovascular disease and in interventional cardiology at Hahnemann University Hospital. Dr. Kaulback is the medical director of our cardiovascular service line for the network, co-medical director of the cardiac catheterization laboratory at Inspira Medical Center, Mullica Hill, and serves on the Cardiac Partners Board of Directors. He is board certified in cardiovascular disease through the American Board of Internal Medicine and a fellow of the American College of Cardiology. Dr. Kaulback strives to provide the highest quality and most compassionate care possible for his patients. He's committed to education and customized treatment plans. Dr. Kaulback, thank you for joining us today.
Well, thank you, Matt. It's a pleasure to be here. I want to thank the folks at Spirit of Women, Jenna and Suzanne, for their help in preparing this talk for us today.
Very good. Thank you, Dr. Kaulback. So before we get into our topic of heartfelt happiness, are you able to tell us a little bit about the Cardiac Partners relationship that Inspira has with Cooper University Healthcare, and really what this partnership means for the patients within our community?
Sure, Matt. We're very excited about Cardiac Partners, both Cooper University Hospital and Health System, as well as Inspira Health. Both organizations wanted to provide better comprehensive services for the community that has issues with cardiovascular disease. So in 2018, we formed a partnership of sorts where all of the cardiovascular services from both Inspira and Cooper are integrated to provide seamless care for our patients who either suffer from various forms of heart disease or need to be evaluated for heart disease. It's the biggest geographical program in South Jersey with more than 65 clinicians involved in the care and management of patients with cardiovascular disease.
That is great. Thanks for that background, Dr. Kaulback. So we will now turn it over to you to walk us through how our emotions may have an impact on our cardiac health.
Well, thanks, Matt. As you can see on the screen, people who are happy and enthusiastic and have a positive attitude toward life are less likely to develop heart disease than those who are unhappy. That's not just a pie in the sky statement. There's some real science behind it, and we'll talk about that a little bit later. We know that in order to be healthy, you need to do a couple of different things. Eating a diet that's rich in whole grains, fresh fruits and vegetables is essential. You need to limit your fat and processed carbohydrate intake. You should exercise at least 75 minutes per week. And we're talking about aerobic activities, walking, swimming, riding a bicycle, doing some calisthenics, whatever it may be, but a committed time every week, 3 to 4 days a week for a total of at least 75 minutes is strongly encouraged. And it's very helpful if we can find mechanisms for reducing our stress either at home, well, both at home, at work, in all of our relationships, whether they're professional or personal. Some real science is behind these statements. Researchers at Columbia University Medical Center have found that people who have positivity in their life, positive emotions, are better able to improve their heart health. And that loosely translates into saying that those of us who are happy have gratitude for the people around them, the circumstances they find themselves in, and those who find joy in their home life and their work life and their relationships with others are extremely potent, positive medicines toward overall and cardiovascular health.
Great. So we will have our first poll question. So on your screen, you should have seen a poll question pop up. So true or false, people who are generally happy and enthusiastic are more likely to develop heart disease than those who are unhappy. True or false, you should be able to answer right there on the screen, and we will see the responses as they roll in. Give it a couple minutes or a couple seconds. All right. So we have about 95% that got that correct. So that answer is false. So people who are generally happy and enthusiastic would be less likely to develop heart disease. So that was a little trick on my end. I switched around what was the bullet on the first slide. All right. So Dr. Kaulback, what are some of the impacts on our body if we are stressed?
Well, you know, your body has done a great job over the millions of years that we've evolved to do a good job of managing acute stresses. You know, you may have heard of the flight or fight response. You know, when we're acutely stressed, certain hormones like cortisol or epinephrine, also known as adrenaline, or norepinephrine, all three levels will rise in our bodies. That allows us to be more aware and act more quickly to the stress that we're encountering. Cortisol provides sugar in our bloodstream, and the other two hormones raise our heart rate and our blood pressure so that we can manage the acute stress. The challenge is if we're chronically stressed and those hormone levels stay elevated. When that happens, then our blood pressure is chronically elevated, our heart rate is chronically elevated, and our sugar levels in our bloodstream can be chronically elevated. And none of those three things is any good for us over the long term. So finding a way to reduce stress, guilt, unhappiness, you know, anything that lowers the levels of those hormones in our bloodstream is good for us. It's good for our heart, and if it's good for your heart, it's good for you.
So what are some things that we can do to start to balance that?
It's an interesting question. There are, you know, some of this has to be individualized, but increasing positive, happy emotions is a great way to lower your stress and achieve heartfelt happiness, as the title of today's program. Laughing, laughing about anything, having a talk with a genuine friend, caring for a pet, finding an activity other than work that you enjoy doing, a favorite hobby. And if you are struggling to find a friend or an acquaintance to talk to, or you don't have a pet at home, simply keeping a daily journal with positive thoughts is a unique but useful way of creating more positivity in your life.
Yeah, I think when we, were first going through this, you mentioned, there's numerous, apps and platforms out there
Yeah.
that can help with some of this.
Absolutely right, Matt. Don't mean to plug any app in particular, but you'll find that a number of diet apps on the market stress a lot of impact on lowering your negative stressors so you don't reach for food as a way of compensating. And of course, the excess calories can lead to all kinds of negative impacts on our weight and on our sense that we're doing what we can and should do to keep ourselves healthy. So stay positive for sure.
All right, so that'll bring us to our next poll question. So again, another true and false question. It should have popped up on your screen. But true or false, when you are stressed, your body releases hormones that affect you in a negative manner. True or false? Another couple
I'll bet
seconds.
everybody gets this one right, Matt.
That is true. So again, we have about 95% that came through. I didn't trick you this time. I kept it on there. So that is true. When you are stressed, your body releases hormones that affect you in a negative manner. So, Dr. Kaulback, you've given us some great tips today on on keeping our stress environment down. Can you talk a little bit about what that does to our bodies and minds, and how that positive interaction impacts our heart health and bodies?
Sure, Matt. I briefly touched upon it a little bit earlier. The three stress hormones, the adrenaline, the norepinephrine, and the cortisol, raise your heart rate and raise your blood pressure and raise the level of sugar in your bloodstream. By reducing the levels of those hormones, your heart rate slows down, your blood pressure drops, there's less sugar in your system for your body to have to deal with, and hopefully that translates into a lower risk of developing diabetes or high blood pressure or any of the consequences on your blood vessels in any organ in your body, whether it's your brain, your kidneys, your GI system. You lower the risk that you'll develop problems getting oxygen and nutrients through the bloodstream to those organ systems. Positive hormones are not as well understood or as familiar in name, but lowering your stress allows the hormones that do the good things for our body long term to have their impact more easily. Better metabolism of food, so we're not storing as much of the sugars or carbohydrates we get in our diet as fat, and making more use of them in dealing with the day-to-day metabolic needs of our body. Burning sugars so that we can complete the activities of the day easily. I guess this is a really good summation of everything that we're talking about this afternoon. The less stress and more happiness, more positivity in your life leads to all kinds of beneficial consequences for yourself and for your heart. That's why we're here today. We want to help folks understand that you have a lot of control over the likelihood that you develop heart disease over time. And staying positive is a huge step in the right direction.
Great. So at this time, before we get into questions from the audience, and I do want to remind everyone, there is the Q&A feature at the bottom of your screen to submit any questions. But before we get into those questions, can you talk us through some of the management of cardiovascular disease if we do start to show signs? And are you able to give us some examples of services that are performed right here at Inspira and Cooper through Cardiac Partners?
Certainly, Matt. The American Heart Association has strongly suggested through their review of the literature that maybe as much as 80% of all the cardiovascular disease, typically disease related to high blood pressure, diabetes, and high cholesterol, can be prevented or easily managed through regular checkups with your primary care physician or primary care provider. So at a minimum, the ask is for the community to have a relationship with their primary care physician or provider and have at least an annual appointment to go over your general health and address any symptoms or signs of disease that you might have, and then come up with a plan for evaluating those symptoms. That might be as simple as having your primary care physician or provider order some blood work and a couple of simple screening tests, or it may require some specialized opinion or management, such as a referral to a local cardiologist, hopefully a cardiologist within the Cardiac Partners program.
I'll now pull up a slide that shows different services, and you can talk through what some of them mean to have the folks out there.
This is a busy slide. There's a lot of stuff here. On the left, you'll see cardiodiagnostic testing. Both Cooper and Inspira offer a broad range of non-invasive testing to try to figure out if you have any significant heart disease or if you're at risk for cardiovascular disease. I'll use those terms interchangeably. You'll also see that there are cardiac rehab services for folks that suffer from a chronic cardiovascular condition. Frequently, inpatient or virtual rehab services can be utilized to improve your level of functioning and help you do more without putting your health at risk. And then there are the surgical and non-surgical procedures that we do routinely, both within the Inspira health system of hospitals and at Cooper University Hospital. Surgery, cardiac surgery specifically, is performed solely at Cooper University Hospital. You have to have heart surgeons on staff, and you'll find several talented heart surgeons at Cooper University Hospital. We do some management of heart rhythm problems and coronary artery disease, like managing acute heart attacks and putting in pacemakers at the community hospital level as well as the university hospital level. And then there are the very specific procedures for managing some genetic defects or acquired defects of the heart, like holes between chambers that you were born with, or a complication of a heart attack. We have the ability to manage valvular heart disease like aortic stenosis or a leaky mitral valve through a series of minimally invasive procedures such as TAVR, which is transarterial valve replacements, which have become very popular over the last 10 years or so. We are getting better and better at utilizing minimally invasive technology to deal with leaky mitral valves. We do lots of great work managing the risk of stroke in our patients who have heart rhythm disturbances that put them at risk for stroke. For those people that can't be managed chronically with blood thinners, there's a device called a Watchman that can be utilized to minimize the risk of having a stroke. And then there are all the neat things that our specialists in electrophysiology can do to manage heart rhythm problems that occur from time to time, or heart rhythm issues that require devices such as implantable defibrillators or pacemakers to make sure that your heart's functioning efficiently and protected from life-threatening heart rhythm disturbances. That's a whole lot of stuff.
There's a lot, and it's a lot of great information. So thank you for that. So we will now take questions from the audience. If you have not already submitted a question and would like to do so, please submit by using that Q&A function that's at the bottom of your screen. And I did want to start with a comment that came through. It says, "This is such great information. My husband has a stressful job as an airline pilot. He saw his primary care doc this week, and they talked about how this affects his blood pressure." And I think that really touches on, when you start to talk about the management of this, it really starts with that primary care provider. And then as it progresses, we would get into, referring over to a specialist. All right. So we have had a couple questions come through. So the first one that has come through, does Cardiac Partners have any programs or providers tailored, around women's health?
Oh, absolutely. Every one of the cardiologists and other providers within the Cardiac Partners program is more than happy and qualified to help women who are either struggling from some form of cardiovascular disease or have symptoms that require an evaluation. We have several women cardiologists, probably the most women cardiologists of any program, certainly in South Jersey, a total of 8 women, possibly growing to larger numbers before the end of next year. The RIPA Center at Cooper University Hospital houses the Women's Cardiovascular Health Program. There are 7 female cardiologists involved in that program: Kathy Heinz, Andrea Russo, Maritza Cotto, Joanne Mazzarelli, to name just a few. They range in expertise from electrophysiology to cardio-oncology and non-invasive testing specialists. They're all excellent physicians. And here at Inspira in Mullica Hill, my partner, Inakshi Bajpai, who's been with us for, I don't want to say how many years, at least 15, all very talented and very happy to assist any woman who would like to see a female cardiologist and proceed with an evaluation with their assistance.
Great. Thank you for that, Dr. Kaulback. So we have another one that's around some of the hormones. So how long does it take for the stress hormones to level out to normal after you're stressed?
Well, typically under an acute stress, the levels of the hormones go back to normal relatively quickly, a matter of minutes. But if you're chronically stressed, the levels of those hormones will stay elevated as long as that stress is present. So the levels may rise and fall as the levels of stress are modified. The trick is to lower the level of stress so that the body's reaction to that is to lower the level of hormone.
Great. So and we have another comment to that. I have found so it's an app that comes through to be very helpful in managing anxiety. It helps me breathe and focus my thoughts to calm my brain and body.
Yeah, I'm not touting any specific app, but whether it's yoga, meditation, listening to music you like, exercising, listening to uh, the birds chirping outside, taking a walk in nature. As long as it's a healthy behavior, smoking would not be considered an effective stress management tool, for example. As long as it's a healthy behavior, you can pick and choose the process that works best for you.
Perfect. So not seeing any other questions at this time. I just wanted to thank, we have here's another comment that came through. I was 54 when I had a heart attack that was stress induced. I still live with chronic stress and have weight issues.
Yeah, that's unfortunately a far too common observation by patients. I've been in cardiology for almost 30 years now, and uncommon stressors or common stressors can lead to an acute problem such as a heart attack. And the chronic consequences of stress raises our sugar levels and raises our stress levels, and it's too easy for me as well as many others to deal with that stress by reaching for something to eat and not necessarily something nutritious. So, what do? You do the best you can with the stressors you have, and maybe you put yourself in a little better position when you feel the need to eat something when you're stressed by having healthier alternatives, in the pantry or in the refrigerator. Celery sticks rather than, your favorite candy.
Those are great tips. All right, so thank you. Thank you to Dr. Kaulback for presenting today. And a special thank you to Jenna and Suzanne for all their work behind the scenes. We hope you were all able to find this information useful. As a reminder, a recording of today's presentation will be provided to you in a follow-up email this week. Thank you for joining us. Dr. Kaulback, any last words?
I want to thank everyone involved today, the participants, as well as you, Matt, and the staff from Inspira Spirit of Women organization. The fact that all of you took time out of your day today for us to provide information that hopefully benefits you and your families is a unique opportunity, and I'm flattered and grateful to have been given the opportunity.
That's a great wrap up. Thank you, Dr. Kaulback. So thank you all and have a great rest of your week.
Take care, everybody.
Thank you.